just like walking and trying to distract yourself, focus on, get visuals, focusing on other things, just to work with them. Concentrate when you're breathing. Concentrate. Think about your breath coming out. Focus on your breath coming out. Like kind of detach yourself from your body and focus on, not that you can see it, but picture it in your mind. Try that once and see what that looks like to you. Okay, here we go. Okay, avoid going up and down the stairs for about a week. Is that possible for you, or is your bedroom upstairs?
No, it's on the main floor. So
okay.
I have a whole changing station downstairs.
Okay, so you really do, you can avoid going the stairs. Okay, good. Good.
Wait, how many weeks you said?
For about a week.
Oh, a week.
Yeah.
Yeah.
That's when you're still in bed anyway.
Right.
So.
Yeah, that's not
right. Yeah, exactly. 5. You may resume intercourse after bleeding. The lochia has stopped. After your bleeding stopped. The lochia, number 1, the bleeding that occurs after the delivery of the baby happens with cesarean as well. And it's bright red for the first 3 days, then becoming pinkish and lighter in flow over the next week. And pay attention to that, what your flow is looking like. And we'll get into that just soon here. Number 2, may last 1 week to 6 weeks or longer. The average is 3 to 4 weeks. And again, the better you take care of yourself, the more you stay relaxed or like just resting the way we're talking about, the sooner your bleeding will stop. The reason, some of the reason why it keeps on going is because you're too busy, that you're too active. And so, again, the better you take care of yourself, the faster you will heal and you can move on with life. Number 3, you will need to purchase maxi pads for use during this time. No tampons. Number 4, important. If lochia becomes heavier or brighter red, this means you may be overdoing it and need rest. Like after the 3rd day, it's not as bright red anymore, it's more pinkish, and then it kind of turns a little more brownish. If it turns red again, it's like, oh, okay, I better slow down a bit. Kind of think over what you were doing, and you probably will realize, yeah, I've been running, I've been up and doing things more than what I was. And that's your body saying, your body trying to tell you, I'll just rest a little longer. Just take it easy again. So it will give you signs that you're doing too much. Number 6, baby blues. Postpartum depression is very real and due in part to drastic hormonal changes. Your body it's going through, after you give birth, it has really, like 9 months you've been pregnant, you've been getting bigger, things have been, in your body, your organs have been making way, you're kind of shifting. After the baby comes out, your body goes into a big change, because this is a big change that has happened. So don't be surprised that you have some hormonal days. It happens. It just really happens. You'll find yourself crying, especially like 3rd to 4th day. I think we're going to get into that yet too. Oh, right now. Yeah, okay. Let's just look at this again. Crying for what seems like no reason at all. Day 3 to 4, call them puddle days. Very teary and emotional. I'm telling you this just not to say expect this to happen, but if it happens, like, oh, that's what's going on. It's not like I am okay. It's all these hormones are changing, and it's okay. I'm going to be okay again. It happens to all of us. During this time, husbands, be very supportive. Lots of hugs and verbal support. Wife is not broken, and she will go back to normal. Don't worry. If severe or lasted for more than a month, contact healthcare provider, because you really don't want to see these things going on for more than a month. If you do, you might want some deeper help. And again, do not be afraid to ask for help, because maybe all that you would need is just some extra support, or even, doctors will, just don't. That's the last thing that we want to do. Say, I think I'm depressed. It's so hard to say that, but please, don't be afraid. So many people go through it, and it's really it's okay. It's okay. You know, it only gets worse if you don't talk about it. You know, if you ask for help, you know, there's help for it. If you don't, you know, so just be aware of that. Number 7. Okay, just back up a little bit. Husbands, live with your wives in an understanding way. 1 Peter 3:7. So Dathan, for you is just know that she's not broken. This is normal. Just be there to assure her. Don't try to fix her. Just listen to her, hug her, just give that verbal support. Don't try to figure out what's going on. It's normal. 7. Arrange for help with meals, housework, errands, etc. Don't be afraid to ask for help. Like if somebody calls, could you, and don't be afraid to say, hey, could you pick up whatever on your way here? Like if you have something out, like something to pick up at a store or whatever, don't be afraid to ask. If somebody's coming by, people are honored to help. They want to help. So don't be afraid to ask. Or could you please throw a load of laundry in the dryer before you leave? Would be another thing to say if somebody's there. This is the body of Christ functioning and using gifts. Okay, number 8, visitors. This is a big one. Too many visitors during the first week to 10 days can be exhausting. This is not a time to entertain visitors.